Herd at Health is sponsored video content brought to you by MedCity News.
Welcome to Herd at Health. I'm Arundhati Parmar, Editor-in-Chief of MedCity News. And today I'm with John Salon, CEO of MDLive, a telemedicine platform that is part of Cigna's Evernorth business. So John, last year when we spoke about how MDLive was going to expand virtual care, not to just primary care, but also chronic care management. Can you talk a bit about how your telemedicine platform is being used for that today?
Yeah, well, thanks for having me here today. It's been a great year for MDLive and the evolution of our virtual primary care platform this year. We're actually doing about 20 million members who are eligible for the benefit this year, which has increased substantially from last year. We have about a 260% increase in visit volume. So we're really seeing the application take off. As far as our coaching platform goes, we released into the market just this week digital coaching, which is in between visit coaching. So that's coaching for chronic care patients. We're starting with hypertension, and we're going to move into chronic care, other chronic care conditions over the next couple months, including the prediabetes and weight loss management.
Got it. There are other companies out there with health coaches. So I'm trying to understand, how does MDLive's model differ from those existing health coaching programs?
Yeah, so there's certainly a lot of digital apps around health coaching for chronic conditions in the market today. And how we think about differentiating our product right now is a couple things. So number one, it's physician-led. So the coaching is led and instructed by the physician and the care team, which drives much better engagement with the patient. We think that the patient has a care plan, so the physician and the care team direct the patient to a care plan, and that care plan is managed in between visits by our digital health app. We think there's better engagement and ultimately better outcomes. We also have connectivity between an agnostic device strategy, so we have connectivity between biometric devices, think a scale, think a pressure cuff, and we read data and analytics into and out of those devices to enable in between visits the patient to improve their care.
Now, in offering chronic disease management virtually, why did you start with hypertension, and what other patient populations will you expand to?
Yeah, so hypertension is a huge market to begin with. The CDC reports that about 50% of adults in the United States have some form of hypertension, and only a quarter of them are managed properly and in control. So we think it's a very big market. We also think of hypertension as an avenue to other chronic diseases. So typically, when a patient has hypertension and it's not managed, it can lead to other diseases as well, chronic diseases. So we thought it was the right place to start. Additionally, we're going to roll out prediabetes and weight management within the next few months.
Thank you so much for spending some time with us today.